Yeah, Jarda didn't come into me with a specific, like, I have fibromyalgia or I have, leaky gut syndrome or something like that. She came in and she was basically somewhat toxic. She said, I wanted to lose some weight. She was having just kind of a midlife crisis a little bit with her relationship, and so it was maybe a little bit harder than other cases that I get where they come in and they have a specific pathology. Okay, let's work on this because I know where to start. I'm always going to go to those other areas as well, but with you we just went like kind of, let's clean the system, let's get the right homeopathic remedy, let's do a quick, not even a quick, but a tune-up in some respects.
Mm-hmm.
And then in the beginning we did the detox. How did you like that? How did you feel?
The detox worked great, and the weight loss program worked great too. I lost 40 pounds and was able to keep it off. And then, of course, the divorce, the emotional issues got the better of me.
Yeah,
and I stopped with that.
I'm glad that you bring that up because I see a lot of times it's the mental that stops us from getting to where we want to go, from doing what we're supposed to, or what we want to do. And that's one of the things where now I didn't realize this occurrence happened so recently, but we'd have to look at, what a better homeopathic remedy can I give you? And that's not to blot out the symptoms. We're not talking about Prozac here or Xanax or something. This is to help you work through kind of the divorce and the mental emotional issues and come out the other side and grow from it. When you did the detox before, we actually did a detox from a company called Biotics Research. And it starts you out. We modified a little bit. We have an acute for acutely ill, somebody who's in a lot of pain, and then we have one for chronic. And the details, pretty much, there's these bio detox packs. They have about 8 different pills in them, and we're targeting the liver, the gallbladder, the GI system, the spleen, the kidneys, and we're trying to clean everything out gradually, sometimes all at once. And we're also going to use a hydrochloric acid, low dose hydrochloric acid, and also digestive enzymes, because what I've been finding a lot of times, and this is what Biotics Research knew already, and they put it in this detox, is that most people, they have hypochlorhydria, which means they have low HCl in their gut, in their stomach, to digest their food. Where now I see it happen all the time. The same symptoms of having low hydrochloric acid and having high hydrochloric acid, all the burning, the eructations, the maldigestion, they're very similar. So what I see a lot of times is they've been through the medical orthodoxy and they'll get one of the little pink pill or the little purple pill, Nexium or something like that. They'll be on it for a long time. And they had low acid to begin with. Now they're suppressing all their acid. Well, hydrochloric acid is the first catalyst to your first enzyme in a whole cascade of enzymes that actually digest all your food. So if you don't get the pH right in your gut to that first enzyme, you're just going to have the worst indigestion. Your liver becomes toxic because all these toxic reactions start happening. And so basically you need to detox, and that's pretty much what we do with you. So I remember at one point we did the weight loss for life for you, and that system, it seemed to work very well for a lot of people. How did you find it?
I found it easy. I mean, initially, of course, it's cut back on a lot of foods, but the packets worked very well, and were fillers in the meantime. I like the idea of logging foods. I don't know, for some reason that works better for me. And then I get this...
When you can see what you're eating and how much? Okay. Yeah, the weight loss for life, I've had some pretty good results with it, because what it does, it's actually set up by a naturopath in Australia, and you measure your urine. You look to be in trace ketosis. Not Atkins, where you're in full-blown ketosis, you're taxing the kidneys with so much protein and no carbs. You definitely get carbs with this. But there's no starches, there's no grains. You actually have to do some work, so it's not for everybody, but the people that really run with this and do it correctly, they lose a lot of weight, and it's nice. It's 3 to 5 pounds per week, and the initial is 5 weeks, and then we can do another 5 weeks. But the best part of it is it takes the food sensitivities out, because the foods that you're allowed, they've been researched, and the majority of the people don't have any food sensitivities to those foods. And that's one of the biggest culprits of especially postmenopausal women not being able to lose weight, is all these reactions that those food sensitivities are, it's happening actually to the immune system and cortisol, and they're just bouncing around, they can't lose any weight. And also thyroid, we need to check out the thyroid first. But I've just done the regular blood work for food sensitivities and got people off all their bad foods, and the women especially, they lose 20 pounds in the first month. And so this is even better because we're setting up the weight loss for life. You're measuring your urine every day, looking for ketones. It's a real nice system.
It is. It works very well. Felt great too.
Mm-hmm.